Hi, welcome back to another Pharmacy Republic video. My name is Shazli Hassan and I'm the lead prescriber. Today's video is the first in a series where we're going to look at the debate between psychiatry and psychology. Now, a Cold War has been raging for decades between the psychiatrists and psychologists. I'm going to grossly simplify here. One side wants you to pop a pill, the psychiatrists, and the other side wants to talk to you, the psychologists. However, in all wars, the lines are blurred. We have many psychiatrists, such as Joanna Moncrieff, who actually question the existing paradigm or the dominant paradigm of pushing a pill. Now, what has this battle between the professions got to do with you? Well, it's because the battle is being fought over valuable real estate, your mind. But before we get ahead of ourselves and start looking at the arguments for and against, let's just take a step back and look at the complexity involved. The number of cells in your brain or neurons is 100 billion. That's the same as the amount of stars in our Milky Way. And each of those cells or neuron is connected at junctions called synapses with hundreds of thousands of others. So we have a total of possibly 150 trillion synapses, truly complex. So when talking about this degree of complexity, I don't think anyone has the whole answer. In this video, I will present both sides of the argument. I will argue from the point of view of a psychiatrist, hello, and from the point of view of a psychologist, hi. So before we get into the debate, let's just introduce a bit more about our protagonists. Now, psychiatrists are medical doctors, and they all complete their generic 5-year training at medical school, followed by a specialization in mental health. Whereas clinical psychologists will complete a degree in psychology first, followed by 3 years postgraduate training. So in this first video in this series of debates between psychology and psychiatry, we'll look at the mechanism of action of psychiatric drugs. Now, there are two models proposed by Joanna Moncrieff, which we'll use. One is called the disease-centered model, which is favored by psychiatrists, and the alternative is called the drug-centered model. Now, at the end of the video, you'll have a good idea of what these models mean. Okay, without further ado, let's dive straight into our first battle, which pits the disease-centered model against the drug-centered model to explain the mechanism of action of psychiatric drugs.
Round 1. Fight!
Hello again. So the disease-centered model is based on rectifying an abnormality in the brain. And this abnormality stems from an imbalance in the brain chemicals called neurotransmitters. For example, in depression, we can see there is a reduction in the action or a deficiency even of serotonin and noradrenaline. And so we give drugs such as SSRIs or SNRIs, which prevent the uptake and the activation of serotonin and noradrenaline, thereby rectifying that imbalance. So the drug-based model proposes that these drugs, these psychiatric drugs, create an abnormal brain state. Now, we refer to drugs that cross the blood-brain barrier and change the way the brain and the nervous system works. We call these psychoactive drugs. Basically, what these drugs do, they have mind-altering properties.
Round 2. Fight!
Now, the disease-centered model argues that the beneficial effects seen when we use these psychiatric drugs because they're altering the basic pathology. They are, as we've said previously, they are rectifying that imbalance, and that's how they work. Now, the drug-centered model proposes that psychiatric drugs, alter the psychiatric symptoms by creating this drug-induced state, which basically masks the psychiatric symptoms. For example, people who are depressed and take SSRIs, they say, yeah, sure, I don't feel depressed, but I don't feel any other emotions neither.
Round 3. Fight!
The disease-centered model where it basically says that the psychiatric drugs will work different in patients and volunteers. I disagree. The drug-centered model says that the psychiatric drugs will create the same effect in a patient and a volunteer.
Round 4. Fight!
The disease-centered model provides evidence that these drugs work, because when we did the clinical research, they actually targeted the manifestations of disease. That is, they got rid of the symptoms of the psychiatric disorder, and that's why we know these drugs work. Yeah, but those same results can be explained by just using the drug-centered model and explaining that, yeah, sure, those symptoms are no longer there because they're masked by the drug-induced state.
Round 5. Fight!
And finally, my final argument is I would like to provide an example of the disease-centered model from another field of medicine, endocrinology. In type 1 diabetes, we have an absolute absence of insulin, and so there's an imbalance, and we need insulin to survive. So we have to correct this balance by administering insulin. Also, if we look at the example of the opiate painkillers, we know in exquisite detail how the opiates work. They bind to the mu receptor and they give us pain relief. I would also like to include a final example of the drug-centered model. For example, alcohol. A lot of folks, they use alcohol to help them with their social anxiety. Now, when they get intoxicated or a little bit inebriated, then they're in a different state of mind and they no longer feel anxious. There may be some underlying anxiety, but in that inebriated state, they don't know. Also, coming back to the pain relief, now, yeah, the opiates, they act on the mu receptor, but what they do, they create this mind-altering state, this numbing opioid euphoria, which basically you don't know what's happening to you. You're just having a good time and you're not feeling the pain. So there you have the arguments. So whose side are you on? In further videos, we'll develop these themes and we'll look at the latest research and findings in both psychology and psychiatry. As for me, I'm going to sit on the fence because there's a risk if you see things in black and white. You can throw the baby out with the bathwater. In not all cases are the same. In some scenarios, there is definitely a need for psychiatric drugs. And in other scenarios, there's a need for the psychoanalysis and also the other techniques such as the power threat meaning framework, which we'll look at in another video. So I think adopting a holistic approach and using the best from the worlds of psychiatry and psychology is the best way forward. Now, that's the end of this video. I've hoped you liked it. I'll try to make it as entertaining as possible. If you haven't done so already, please subscribe and don't forget to click that bell icon so you get notified of new videos. If you have any questions, just leave them in the comments and I'll get back to you. That's it for now. Take care. I'll see you next time. Thanks. Bye.